Hello, hello. Can everybody hear me?
I can.
Hey there.
Fantastic. It would be nice if I plugged my headphones in. There we go. All right, well, let me do a quick introduction here. And today is Friday. As always, I love to do these Friday Friends, and I'm super, super excited to be here today. Taking a quick coffee break with a couple of my besties on these Friday Friends. So like a week ago, I think it was, Aaron and I were able to connect on a one-to-one call and get to know each other a little bit better and hear some of the story and the backstory on Solace Health. And so I loved it. And Aaron was kind enough to introduce me to Sara, the co-founder. And I can't believe it, but they both agreed to hang out with me today. So for those of you that don't know me, my name is Nicole Broadhurst. I am a former healthcare administrator turned independent patient advocate, CEO and founder of Tennessee Health Advocates, where we help busy, committed professionals maintain work-life balance, take control of medical bills without the frustration of medical billing departments. So that's what we do over there. But this morning, I want to hang out with my friends. So I'm super excited to have Aaron and Sara here with me. They've also both agreed to join us on Wednesday in the Circle, Advocates Surrounding Patients with Support, which is a group of advocates where we hang out on Wednesdays. We talk about advocacy best practices, general business practices, what's happening in the independent advocacy world, which is what leads me to today. So Aaron, I would love to hear from you for just a minute and tell me why you decided to connect me with Sara and get this kind of ball rolling with what we're doing here today.
Well, why I wanted to connect you with Sara, or why Solace is doing what we're doing? A lot of whys there. Because I have to say, one thing for sure is the work that you do as an advocate, Nicole, we think is absolutely amazing. That is our reason for creating Solace, really. Well, I only joined the team recently. Sara, along with our other co-founder, Jeremy. That's why they put this together. I think you can speak a little bit more to that, Sara.
Yeah, thank you so much for having us, Nicole. This is a wonderful opportunity, and it's really nice to meet you.
Nice to meet you too.
But yeah, as Aaron mentioned, we started Solace for the same reason that a lot of advocates get into advocacy, because of a personal experience my co-founder, Jeremy Garowitz, had with the medical system. Jeremy's mom was a really accomplished radiologist in New York City. She diagnosed women's breast cancer for a living. So she was very knowledgeable herself about the medical system. But in 2016, she was diagnosed with late-stage pancreatic cancer. And that diagnosis kind of turned their family's world upside down. Even with her knowledge, she struggled immensely to navigate that diagnosis. You know, which course of treatment was going to truly be best for her quality of life, which treatments would cancel out which clinical studies. You know, it's a very familiar story, and it's exactly what advocates can and do help with every day. It was a lot of heartache, and Jeremy got to witness firsthand how difficult it is for anyone, no matter their background, to interact with our healthcare system. So when we started Solace, we wanted to build a way that no one would ever have to go through something like that again.
I love it. I love it. And this is why I love hanging out in this industry, is because everybody has such a servant heart. Like, you know, there's this just authentic desire to create something that is helpful to others. And it's like no other industry that I've ever been a part of. You know, the healthcare industry, I believe that the hearts are there. The system just doesn't support those efforts, right? And yeah, and that's where it's kind of heartbreaking, right? Because we have an industry full of people who want to be helpful and a system that really kind of gets in the way of that. And so always super excited to be connected with other folks who have this servant heart. So you guys are going to join us in the Circle on Wednesday. Like I said, this is a group of independent advocates who on a daily basis are doing exactly what you said, like helping patients and families navigate the intricacies and the complexities of this, what feels like an insurmountable system, right? With that information. So without giving away too much, like what is it that you're going to share with us on Wednesday? Because that's where we're going to have like a whole hour to kind of really get into the weeds about Solace and what you guys are doing and how we as independent advocates might be able to help with that effort.
I'm so excited. I'll try not to give away too much. But we believe that advocacy is so critically important in the American healthcare system. Most people don't have the medical literacy to navigate any sort of complex health issue without an advocate. But what we were finding in our early explorations is that very, very few people know what advocacy is. And that's a tragedy because this is such a powerful field that truly can and does change lives. So we started Solace with two goals. One is to massively increase public awareness of advocacy, and the other is to provide an easy way for patients in need to find and work with advocates. So what I'm going to be showing next week is our platform itself, but to give a sneak peek of it, Solace is a marketplace platform like Airbnb, an online platform that connects patients with advocates, and also gives advocates the marketing and business tools that they need to be able to focus on helping people and not struggling with how to run a business. Because I've heard
Right. And that's real. The struggle is real.
Yes. We're doing this at no charge to the advocates. There is no cost associated to being listed or using Solace for advocates. And yeah, I'm really excited to show it off. My intention is to build something that functions less like a directory that you have to search through and pick up the phone after, and feels much more like an experience. A modern, beautiful platform that helps clients find who they're looking for, matches them with an advocate who can help them, and then continues through that booking process and makes it a very seamless and easy experience for clients to connect with advocates.
I love that. I love that for so many reasons, but mainly because it's already so hard, right? It's already so hard. And so I think that, we as advocates are always looking for, how do we make it easier? How do we make it less stressful? How do we make it, more or less painful and more comfortable, right?
Yeah.
So I love that.
Like what you said earlier about this industry strikes me very true. Is it's a lot of servant hearts. There's an immense amount of heart behind the advocacy industry, and it would be my privilege to be able to enable that heart to reach more people and take away everything that you struggle with on a daily basis that's less fun than what you guys are so skilled with doing.
Yeah, I love it. Aaron, what were you going to say there? I heard you.
I think Sara said it better than I could have. I just want to say, but it's amazing. Literally took words out of my mouth. What advocates have been doing in this space, where so many are running smaller businesses, and they have been doing their sales, their marketing, their own basic business administration, and still finding the time to actually care for people and provide those services. Talking to advocates and trying to be a part of this community has really blown us away. We've absolutely loved it so much, and it just makes us want to do this even more.
I love that. Well, that just warms my heart because I feel the same way. I connect with a lot of advocates on a regular basis every day, and you're mimicking like exactly what I'm feeling and seeing myself in the industry and hearing as well. As new folks are coming into the industry, they're saying things like, "This is the most supportive industry that I've ever seen." Like, I can't believe how helpful everyone is, and how So anyway, it is a breath of fresh air. And I'm so excited to have you guys in the circle on Wednesday. I think that it's going to be wonderful working with you all. And if you're an independent advocate and you're wanting to join us in the circle, you can do that. It's super easy. It's www.thepowerfulpatient.com. And you can join us there. We meet every Wednesday. We have lots of resources and tools and new and upcoming things happening in the industry. Join us there. Erin, Sara, I cannot thank you enough, and I'm so excited to see you in the circle on Wednesday.
We can't wait. Thank you so much.
Thanks
Have a great day. Bye, guys.
You too.